Hi, I'm Bill McGuire. I'm a paediatrician in York and I'm the Chief Investigator of the Elfin trial. The Elfin trial is a large, pragmatic, multi-centre, randomised control trial in the UK. The trial aims to determine whether supplementing the diet of very preterm infants, those are infants born before 32 weeks gestation, with lactoferrin can prevent infections and bowel disorders. Lactoferrin is a natural antimicrobial protein present in the milk of all mammals, including humans. Lactoferrin works in a variety of ways to prevent viruses and bacteria and protozoa causing infections in young mammals. Now, for a variety of reasons, preterm infants, and especially very preterm infants born before 32 weeks gestation, receive very little natural lactoferrin in their diet. And the aim of this study is to determine whether supplementing their diet with extra lactoferrin can reduce infection and other bowel problems. There has been one previous published trial of lactoferrin supplementation for very preterm infants. This was conducted in Italy a number of years ago, and although small and with some problems, did indicate that potentially lactoferrin may be effective in reducing the incidence of infection. Now, the current evidence isn't sufficient for us to adopt lactoferrin as a standard of care for very preterm infants in the UK, but it certainly supports us undertaking a large, simple, pragmatic randomised control trial to provide the best evidence possible to determine whether we should be using lactoferrin to prevent infection for very preterm infants. The hypothesis driving this trial is that supplementing the diet of very preterm infants with lactoferrin will reduce their chances of developing infections and other complications. Some infants, about half, will be allocated to receive lactoferrin, and as a control group, the other half of the population will be allocated to receive a harmless placebo. Now, we won't know which babies are receiving lactoferrin and which babies are receiving placebo until the very end of the trial, at which point we'll look to see if we've found good evidence of an effect on the risk of infection or other complications. Well, the key simple eligibility criterion is being very preterm. In other words, being born before 32 weeks gestation, because we know those are the infants at highest risk of developing infection while in hospital. This is a simple and pragmatic trial, and we really aim to provide evidence that's generalisable to the whole population of very preterm infants. Importantly, infants are eligible whether they're receiving maternal breast milk or donor breast milk or formula. Similarly, there are few absolute exclusion criteria. Lack of parental consent, of course, is number one. Other exclusion criteria are severe congenital anomalies and the likelihood an infant won't receive any enteral nutrition for the first 2 weeks after birth. For example, due to a congenital anomaly such as an anterior abdominal wall defect. The primary outcome of the Elfin trial is late-onset invasive infection, mainly bloodstream infection or meningitis. These, by definition, are infections that occur after 72 hours after birth. The other outcomes that we'll be measuring are necrotizing enterocolitis, exposure to antibiotics to treat infections or necrotizing enterocolitis, length of hospital stay, incidence of retinopathy of prematurity and bronchopulmonary dysplasia. We intend to recruit about 2,200 infants to take part in the trial, over 30 centres in England, in Scotland, in Wales and in Northern Ireland. Now, in addition to those 30 recruiting centres, of course, many infants will then be retransferred for ongoing care to smaller neonatal units or neonatal units closer to the infant's home. We've been really fortunate in developing this trial. We've had lots of support from the National Perinatal Epidemiology Unit in Oxford and from clinicians across the country who, when we've spoken about this trial, have been very enthusiastic to support it.